warm welcome to Pagets Awareness Day 2022. I'm Dr Tori Herridge, an evolutionary biologist at the Natural History Museum in London and friend and supporter of the Pagets Association. Pagets disease of bone is the second most common bone disease after osteoporosis, but many people have never even heard of it. And there is still so much about Pagets disease that we just don't know. But thanks to the work of the Pagets Association, this is changing. And this year, the association is bringing a global perspective to bear on Pagets disease of bone to challenge the idea that Pagets is solely a British disease and to explore what we can learn about causes, history, and treatment of Pagets disease by looking beyond the confines of a single country. It's my great pleasure to welcome you all to this year's series of video interviews, where I'll be interviewing experts from across the globe to hear their unique perspectives on Pagets disease. For this episode, I'm talking with Dr. Luis Corral-Gudino from the University Hospital of Rio Ortega in Spain. Welcome, Dr. Corral-Gudino.
Hi, hello.
Thank you for joining us. If you could start by just saying a little bit about yourself and how you became involved in treating people with Pagets disease.
Okay, first of all, thank you for the invitation to make this interview. Yes, now I was working in Valladolid. That is a place 2 hours by car from Madrid, and I have a post of internal medicine and also have an associate professor post in the University of Valladolid. I became involved in Paget bone disease for the very beginning of my specially registered period, because I did this period in Salamanca, just in the border with Portugal. And in the northwest of Salamanca, we have a hot spot of Paget bone disease. And when I did the specially registered period, it's not unusual to see patients with Paget bone disease. Even my doctorate in the University of Salamanca, 2004, was a thesis about the cytokines in the pro-inflammatory cytokines and Paget bone disease. So I really attached to this disease.
You actually jumped ahead and answered one of my first questions, which was about hotspots. But let's just sort of roll back a little bit and talk about Spain more broadly. How common is Pagets disease of bone in Spain?
It always we think that British is the origin of Paget bone disease, and this is because in most of the skeleton ancient patients with Paget disease are from the British Isles. But to be honest, there is not the oldest ones. We can find also in archaeological sites in Spain or France or even in South America, skeletal bone disease that suggests to have Paget bone disease even earlier than in the British Isles. In Spain, it's not as frequent as in United Kingdom, but we have these little hotspots. They are not similar to the hotspot in United Kingdom, because in Spain usually are little rural areas. Most of them have to be related with cattle farming or something like that. It is not an urban disease in Spain. In the past, it's most frequent in the center of the country, in the old Castilla.
Yeah, I've been looking at a map of Spain from one of your papers, and it shows, I mean, there's obviously quite a few areas with no data at all, but it looks like the coastal provinces have very low incidence. And then the internal section starts to get higher, 2 to 3%. And then within that section, like a donut around Madrid in the center of Spain. And then within that, there's all these different hotspots, but they're not connected.
Yeah.
They're not connected to each other. You mentioned one of them in the area of Salamanca, but there are other ones as well. I mean, I just thought there was like, what was it, Zamora, Terra del Campos. I see, and I'm not going to try and pronounce this word. I will try and pronounce it. You can laugh at my terrible accent. I apologize. It's is it Guadalajara?
Yeah, Guadalajara. Yeah.
Guadalajara. Sorry. Here we go. And it's just that they're dotted around, aren't they? I mean, is there a connection between them?
No, it's not a connection between them. And even in the province of Salamanca, you can find this area that have in the last decades of the 20th century, maybe have a 4 to 6 higher prevalence than in the rest of the province. And places that are pretty near, maybe 30 kilometers or something like that, have difference in prevalence really amazing, like having 20 to 30 new cases every 100,000 people, and in the next area only 5 new cases, so 4 to 6 times higher.
So you mentioned already that these are rural areas. It's a disease of rural communities, which is something I think that was also mentioned by Daniele Melotti, who I interviewed about Pagets disease in Italy. This is a rural phenomenon. But I mean, are we talking, are you then suggesting that environment is more important than genetics here? I mean, are there, do you see this sort of a high level of familial cases like is seen in Quebec, in Canada, or in the UK?
Yeah, just now I live in 1 hour by car from Salamanca. It's pretty near, but we are not finding any cases of Paget disease. It's pretty infrequent in the area I was working just now, because the rural area in Valladolid is not exactly the same as in Salamanca. Salamanca is more related with cattle farming, and Valladolid is more related with the harvest. It's like the wheat extensions in Spain. This is a tremendous extension of wheat fields. With the evolution we are seeing of Paget disease, that is not exactly as severe, as frequent as in the past, the theory of genetic, that for sure is sure. We are, especially in British people, we are finding genetic markers of the disease. So for sure, there is a component that is genetic, but have to be, in addition to this genetic component, other that seems to be related with environment. And what some things that are changed dramatically in the last 4 to 5 decades in countries are related with health things, like vaccination, not only for humans but for animals, like the kind of work. In the past, we are finding people working in the fields, really a strong physical work that is just not now in any place of Spain or United Kingdom, because we have a much more sedentary lives with less skeletal stress, to say in one thing. We have a real change in health of things. In the past, we try to associate Paget disease with some diseases like infectious diseases, like paramixed viruses. These have not been proved, totally never. So we don't have any absolute proof or evidence of this relation of the disease with an environmental factor.
Do you have any sense?
Yeah.
Or any ideas of what you think might be going on?
It seems to be something related with environmental, at least in Spain. In United Kingdom, you can work with other theories about genetics and ethnic makeup, because in northwest of England there is a lot of immigration for countries like Pakistan or India that are really low prevalence Paget disease places. But the local rural areas in Italy or in Spain have nothing similar to this kind of immigration. There is no change in the ethnic makeup. So you have to work with all these environmental things. In the medieval period, when Spain was under the Arabic Empire, these places of Castilla are most of them inhabited. There is no people, and most of the Christians go from the north, from the kingdom of Leon or something like that, and was going to the different place in the old Castilla. And we try to connect with this inheritance, because maybe this Zamora or Guadalajara or Madrid's focus have the same origin with the new colonization of the Christians after the reconquering of Spain, but they are not related, because there are people from pretty different backgrounds. There are Basque people, there is people from the Galicia people. So there is no, it's not possible to make a connection in terms of genetics, but it's more clear to make a connection in terms of activities like cattle farming, that most of them have this kind of economic activity as the most important.
That's really interesting, and I think that feels like a change between something you originally considered, which was looking at the incidence and prevalence in that one hotspot within Salamanca. Is it the Vitigubino region? Yes. And compared to Salamanca as a whole, where you saw not much change in Salamanca as a whole, but you saw a big change, like a massive increase in, you know, between like the 90s and the early 2000s in Vitigubino, and then a decrease.
Yeah, the massive increase in the 90s and 80s is easy to understand, because in the past we are not making labs to this patient, and most of the patients with Paget-borne disease, yes, now are diagnosed because we are asking for X-ray for other reason, or we are asking for labs for other reason. There are not symptomatic patients, and this is because when we start looking for the patient in Vitigudino, we find a lot of patients. Yes, after then we are finding less and less patient, and at the end, the prevalence in Vitigudino is pretty near that the prevalence in the rest of Salamanca, and only an environmental factor could explain that. But to be honest, we don't know too much about what is this environmental factor. There is a lot of things have been related with Paget-borne disease, like untreated water, or like having cattle, or having dogs or pets in your house, or eating unprepared food when you are younger. But none of them has been associated in all the different spots, and it's not possible to make a clear connection.
You wrote a really in-depth summary of global trends in Paget disease of bone. Thank you very much, Dr. Luis Corral-Gudino from the University Hospital of Rio Ortega. Thank you for joining us today.
Thank you, I'm delighted to help.